British Columbia's Chief Medical Officer of Health, Dr. Bonnie Henry, recently sparked controversy by potentially supporting the distribution of free, safer supply methamphetamine to vulnerable adults and youth. This stems from a recent report which evaluated the province's safer supply programs and aims to reduce overdoses and deaths by providing government-funded alternatives to illicit substances. Joining us to dive deeper into the concerns about this development is columnist Adam Zivo. Adam, welcome back to Forum Daily.
Thanks for having me back.
So what's the argument for extending safer supply to meth? What evidence has been put forward to suggest that this will end up saving lives?
There appears to be no evidence that providing safe meth will save any lives at all. The sole study that is used to justify this potential policy position is a study that was published by the BC Centre for Disease Control back in October. And what the researchers essentially did is that they interviewed a large number of drug users and asked them, what are your thoughts on receiving free, quote unquote, safe stimulants? And when the drug users naturally said, we would love to receive free meth, free cocaine, free crack, the researchers concluded that we should do that. There was no additional analysis to show that that was actually beneficial. The reasoning was genuinely, well, they want it, so we should just give it to them. And this is actually a fairly common problem with safer supply research, where many harm reduction activists will claim that their research actually supports the expansion of safer supply, but when you delve into it, there is no real evidence to support that claim.
And you made a distinction there with stimulants. What makes meth different from what is currently included in BC's safer supply program? Why is meth different or worthy of additional concern from your point of view?
Well, so as of now, safer supply programs in BC distribute Ritalin and Adderall as a form of safer supply stimulants. And these stimulants are usually used to treat attention deficit disorder. And the idea is that if you give people these stimulants, that it will dissuade them from using meth or cocaine. But they don't like that because it's not strong enough. So what the BC government has concluded is that, well, we don't have any evidence that this works, so we just have to lean into it and give stronger stimulants, hence the use of meth. They noted that meth is prescribed for attention deficit disorder and obesity in the United States. And they figured, well, I guess if it can be used safely there, then it can be safely used in this context, even though the contexts are entirely different.
How is meth prescribed in the United States? Because obviously that's a pretty jarring discovery. Most people wouldn't be familiar with that. Can you explain that to us?
Well, I mean, when you take a stimulant, it suppresses your appetite. So it has been approved for use in the United States to help suppress your appetite to manage obesity. And stimulants in general actually counterintuitively calm down people who have attention deficit disorder. Now, I didn't go too much into the use of meth in the United States. I just saw that it was referenced a few times in the materials published by Dr. Bonnie Henry, which is BC's top doctor, and her affiliates. Okay. Now, I do want to stress that they haven't come out completely in support of this. They've alluded to it, and they say we want to expand safer supply stimulants and provide smokable options. And when I saw that study, I emailed the BC Ministry for Mental Health and Addiction. I asked them, well, what does that mean? And then they didn't answer. They basically passed me off to Dr. Bonnie Henry. And then I asked Dr. Bonnie Henry's office, are you referring to crack cocaine and meth per the study that was produced recently? And I do want to clarify that the head researcher of that study, Dr. Alexis Crabtree, actually co-presented the Safer Supply report that the BC's top doctor had presented last month. So they obviously work together. And Bonnie Henry's office said, well, you know what, we are against providing illegal drugs. So that excluded cocaine and crack, but it didn't exclude meth. So I sent them several follow-up emails, 3 different follow-up emails. And I said, well, what is your stance on prescribed meth? And they refused to answer, no response, despite the fact that they'd answered my previous emails. And the federal minister of addiction and mental health, Yara Sachs, on Twitter criticized my reporting, but refused to rule out the use of prescribed meth. So it seems to be something that they are seriously considering.
Adam, thank you very much for your time today. Really appreciate it.
Oh, thanks for having me.